after a long day of work.
And isn't the foot sort of an erogenous zone?
It is. It has some great spots behind the ankle and the top and the bottom. You're not tickled, are you?
You're lucky.
One of the other techniques is also cradling the toes. And women will notice this when you get manicures, they do this. You cradle the toes, you rotate each one of them. Make sure you don't do it too hard because some women are very sensitive.
Yes.
Cradle, cradle. And also another technique. And sometimes, and keep in mind, you can all
right, guys. Let's see. Welcome, one and all, to another episode of Try Virtual
Roundtable.
Yes. Thank you. So today is Easter, or not Easter. It's not Easter. It's Mother's Day. Yes. So happy Mother's Day to all those out there. Just wanted to wish everybody, my mom, Donna, happy Mother's Day. My wife, Tracy, happy Mother's Day. She's the mother of my children. So I just want to just point that out. And what number episode? We're on episode.
Can we say hello to our mothers too?
13. I'm going to pass it off to Doc to talk about his
healthcare.
mother.
Look, happy. I don't know if my mom was able to join, but happy Mother's Day, Mom, Rose Smith, out in Arizona. And I hope you have a fantastic day and all the good stuff. I'd be here too long saying all the good stuff.
Nice. There we go. Oh, 11 Goddesses on. All right. Hey. Goddess, hello.
Welcome. Thank you for joining.
What's up? All right, Devlin, what do you got for Mother's Day?
Happy Mother's Day to my wife, Happy Mother's Day. And obviously, my Happy Mother's Day to my mom that has passed away. So happy Mother's Day to her. But happy Mother's Day to all the mommies out there. So just real quick before we go any further, I am sick, so it's their lucky day.
Yeah, hit the little thing.
Yeah.
You guys can,
He'll be talking less.
Yeah.
Man, the crowd's going wild.
Woo!
So take it over, guys.
All right. Well, today we're gonna Doc is actually not only our host, but he's also our guest because he has written a few books about healthcare for feet. One is just general natural feet, and then the other one's about diabetic. But he's also he's helped us create a charity initiative also that we will be talking about a little later called Heart. He'll explain that. And he's also creating a big health area in the multiverse. So it's kind of like, VR healthcare in the multiverse. So I guess I'll just let him start taking. I do have some questions when they come up. I know a couple of comments will be coming through. Questions. My mom had a couple questions because my father has diabetes also, like I do. And so I know it's a kind of a general topic today, but I specifically have some foot questions. So anyway, Doc, take it away.
No, I'm here with, look, I really appreciate the intro and some of the stuff I've done. Thank you. And what I want to say to Devlin, the reason why we're trying to get rid of him, because all my videos he could have chosen, every single one that I've done for television, he chooses one where I do a foot massage, which has absolutely
he's a television star.
Really, out of
also.
all, please. Yeah, I did that a long time ago in Florida, and I don't remember the producer's name, but kudos to her because she really brought me on whenever I wrote a new book. So I really want to say thank you to her.
Well, I'll just say this: you did look good, though, Doc. Come on.
I did look good, dude. You see the maroon and the little vest thing? Look, all you ladies out there, I don't look that good anymore, so I apologize.
They don't know what you look like right now.
I would have made it up. This is all like AI right here. But look, thank you guys. I really appreciate everybody coming out, our multiverse family, as well as family and friends and those mothers out there. Fantastic day. Iceman and I were talking, as well as Devlin, talking about how important healthcare. And as Iceman said, I created a healthcare area in the multiverse. And you know the name of our show, Try Virtual Roundtable, and what makes us different than a lot of shows out there is we're trying to create a segue of real life and how it integrates into the metaverse. And if you don't know what the metaverse is, in virtual reality, these little devices right here, the VR headsets, is really how you can access some of the things we're going to be talking about. So let's start out, and which is everybody's question: why feet? Everybody's. I guarantee a lot of people like Yep. Wifey. Devlin, where's yours? Oh, in the back on the fancy charger thing that none of us can afford but you. So listen, um, so look, so I first got when I first came into VR, obviously I was as lost as everybody. Let's try to figure out what was going on. And once I started figuring things out, I realized it was the perfect platform to create some sort of health initiative. And as everybody was developing what they were developing, it was I figured that was my niche, as the virtual world is growing. So I create VR healthcare, and the goal of that platform, and again, that's in virtual reality, is to create a hub where people can come together and discuss health problems. It could be medical or allied health. And these guys helped me grow it. You guys did when you first got there. You guys helped me set that up in a sense.
Ran the street.
So
Yes, we did.
we got him some money. We worked the corners. That's right. We worked the corners for him.
So after I scammed these two fools, I was able to continue to develop VR healthcare into something that was really, really, really cool. And in the future, we're going to get more into how I'm able to do that or execute that on in the VR world. Because as we've explained it before, you can create these gorgeous rooms, videos. You can talk about different products and allied health and stuff like that. So anybody wants to know more about that, please contact us. We can talk about that in the future and tell you how, if you're interested, how we can integrate.
Media for You can set you up with your storefronts, get you all ready for your
websites, whatever you need.
In the metaverse, yes.
Yeah, of course, my daughter's going to call me right in the middle of the podcast. That's interesting.
She has a question.
Yeah, she has a question. So anyway, so back to why I chose it. Honestly, where I have no doctors in my family, so when I went to school, I was into something about cutting the cats and stuff like that. I kind of like that, the pigs and like high school and stuff like that. So I went to college. I was like, ooh, I want to cut some stuff. so the lady was suggesting that, why don't you do biology? I was like, yeah, biology. And then she said, and then I found out probably a good year or so in that was kind of like a pre-med track I was on. I was like, pre-med.
I didn't mean to do that.
Yeah, that's a problem. So when I started investigating medicine, the School of Podiatric Medicine came down, Temple School of Podiatric Medicine, and I read an article talking about history of amputations amongst the community, where there's at that time, it was over 250,000 non-traumatic amputations that were happening in the world. In other words, not an injury, it could be an injury, but not something traumatic. It was basically something like misguided information on how to handle your diabetes from home. Basically doing stuff that could be easily preventable. And that's the sad part about some of the things I've seen, is that people can a lot of injuries can be prevented. And so I spent my career trying to prevent that. I did my residency at Newman Medical Center in Philadelphia, Northeastern Hospital, which Newman Medical Center focused on limb salvage and circulator boots and revascularizing folks. We teamed up with orthopedic as well as the vascular groups there, and really try to do some great things. But I mean, that's my life in a nutshell in terms of medicine and podiatry. And like I said, my goal is to kind of save somebody one limb at a time or something like that. Like, so since I'm lower extremity, I do surgery. Well, I don't do as much surgery as before, but I still understand a lot of cases. To see a lot of patients post-op from other issues. Go ahead.
Do you mind if I?
Yeah, no, jump in there.
So usually your surgeries are gone after 3 o'clock or something like that, because usually you call me at like.
No, I don't do it. Look, let me tell you something. COVID did a number.
You don't really do much.
I
call me and you be like, "Hey man, I'm going home." I'm like,
yeah, I don't. Yeah, that's just basically my schedule is set up now with the federal health, with a system that I'm in, that I don't do as much surgery. But anyway, that being said, I know people out there have questions. Iceman, I know you got questions. Let's go. That's how I lead into this.
Do you mind? Let me real quick. Attila, you glad to be here. Hope everyone is doing well. Well, I'm sick, but I'm still doing well, but not feeling as good as I should be. But there you go. Now questions. I see.
Oh, well, I mean, I have just a little bit about me. So, and this will lead into the questions that I have. So I had, I hurt my foot, and I thought, oh, I'm fine. I went to the foot doctor. They couldn't find really what was wrong. He says, come back in a month. I was like, I'm good. Right. So like 5 months later, I I had to go back because there was something else. He says, well, you need to inspect your feet and all this. And I'm like, okay, blah, blah, blah. I didn't really get it all. And then I got an infection on my toe. And then it got so bad to where like it was really bad, purple and black. And so then the doctor that happened to be on call was the one that I went to, and he opened the door and saw me, and he just shook his head. He's like, I told you to come back. You never come back. And so then that taught me the importance of listening to the foot doctor, the doctors, and yeah, just basically follow-ups. But anyway, that led to my toe being amputated, which in turn, diabetes is really bad. So things just didn't heal. I ended up getting an infection below the knee amputation. 3 weeks later, I was back in again above the knee. So since he said he was focused on the prosthetic part or the limb loss part, that was like we had that connection. But so I guess one of my questions is, which I hear throughout the people who I talk to within, like the the prosthetic community, is not noticing, like, how do you check your feet and stuff. That's one of the big questions. My mom had that one too.
Well, I remember we talked about this earlier. You mentioned the mirror. I mean, and again, what I just said previously, you just fell. Obviously, we know now you fell into that right into that category of non-traumatic. That had you just paid a little bit of a little closer attention, that would have been seen because you just saw it and you just said, "Wait a minute, something's wrong here." But if it was on the bottom of your foot, you might not notice. Now,
I
I
didn't
don't
because with diabetes, you
the
can't feel
neuropathy.
your bottom of your feet also.
The neuropathy. Yeah, that's what I was
Right.
going to flow into. So all of a
Oh,
sudden you don't
sorry.
see
Yeah,
it.
go ahead.
No, no, no. You're perfectly fine. That's what happens. But daily inspection is imperative in terms of people with diabetes, especially if they have neuropathy. And for those of you out there who don't understand neuropathy is, it's just simply diabetes damages the nerves and the smaller nerves. And because the feet are in shoes, they get, a lot of trauma, right? Now, what I mean by trauma, I'm talking about walking. Yeah,
That's
going upstairs.
That's a trauma for them.
That's the trauma in a sense because that excess sugar in the bloodstream interacts with the nerves and it damages them to a point where you can't feel, and that's why your podiatrist or your family practitioner or whatever doctor you see does monofilament testing, which is a low filament and that's weighted at 5.07. I'm just not sure the weight, but that's where it's the minimum
What
point
what
in
what
which you
is
can feel.
what is that? Is that the little thing they stick your
Yeah,
toes with
and it bends.
what how does
And it
that
bends a
work?
little bit. It's like a filament. It's the minimum that you should be able to feel, if I'm explaining it correctly. So if I hit you with that, it's like a little, uh, it's like almost a little wire that has
Okay.
a certain thickness to it, and it applies a particular amount of pressure. Normal, you can feel it. Abnormal, when it starts getting to the neuropathic stages, you can't feel it. So it's not stabbing you with something that actually bends. It's like a little wire that bends,
Oh,
and
okay.
And
you
then
should.
so they say, like, because they did that with me, and they go, Tell me if you can feel
And you feel.
this," and then
Mhm.
yeah, if you can't, then you're basically you have
You're
neuropathy
getting there.
at some
Yeah.
point, right?
Yeah, and then you have what we do is proprioception, where we grab a toe and move it up, down. And if I'm pushing your second toe up in the air and you can't feel it, we know we have a
We got a
situation.
problem.
So it's simple. It's simple stuff like that. But as far as inspection, just to answer that question clearly, if you're diabetic, it's just important to inspect every day. And if you see anything, follow up because obviously in my years of treating patients, I've seen where one patient, a colleague from Texas, young guy, scraped his leg on the side of the pool. That's all he did. However, he had been educated on, dude, any cuts, any bruises, anything, like, please come in as soon as possible. He didn't do it.
Oh,
So he ended up in a situation, obviously.
right. All right.
And it's
Real quick
sad because
question.
that's not traumatic. I mean, it's a traumatic little issue, but it wasn't like a car accident or anything like that. It was just
Right.
simple antibiotics would have probably cleared that right on up. And back to yours, Iceman, what happened with you is the toe became ischemic because it was caught too far, and it progressed a little too far. And in surgery, which I have done, when you're amputating a portion of the foot, you have to take it back until you see good blood flow. But
Uh-huh, that's
yeah,
what they say.
right. And sometimes you can't really tell. Look, remember, bacteria expands exponentially. So that one little bacteria that's kind of, or a little bacterial area
Hmm.
that's just kind of there, it just
Spreads.
exponentially grows and causes more problems. And
What?
then obviously
How
when the
how
bone
fast?
gets infected,
How fast does it usually like the growth? How fast can it
Really
really?
asking me technical questions like one quarter of an inch per what, man? That just grows, man.
Give or take,
Asking
it
about
goes
technical
fast.
questions.
Well,
I don't
it's
know how fast the bacteria
it's
grows.
A week,
But it
2 weeks.
goes
I
quickly,
mean,
though. Honestly speaking,
okay,
it's
okay,
relatively quickly because it's growing exponential. One bacteria
right.
becomes two, two becomes four, four becomes eight. And, it becomes whatever number
Oh,
it is from a microscopic or
it
pathologist
multiplies.
standpoint. It
and
grows.
obviously your blood is traveling throughout your whole body, so it's pulling it all the time and moving it
Sure.
forward.
You could become septic. Yeah, septic.
That's what
Every
happened. That's what
cellulitis.
happened with me on my below the knee.
Hmm.
It got septic where
Where you
I
got
should have.
septic.
I did. Yeah, I did.
That's what I mean.
Yeah. And yeah, luckily I went back when I did, because it's one of these little stories where they say if you would have waited 2 hours, it might not be. We don't have a drug strong enough to stop this. You
Oh
know.
Yeah.
wow.
Yeah. No.
So immediate amputation went in there. Exactly. You had a question, Devlin?
I you- so let's say like for me, I was growing up. I've always eaten candy and just tons and tons of candy and sweets. And anybody that knows me knows that that's just my thing, candy.
True.
So early on,
Nerd ropes.
yeah, nerd ropes. Oh, I just had, yeah, I had some right here. But early on, my doctor had said, because that was a concern, diabetes, and everybody told me you're gonna get it, you're gonna get it. I'm like, I'm not getting it. I know I eat a lot of candy and a lot of stuff. So my doctor was saying a lot of walking, a lot of circulation will help prevent that. Is that true? Is it how do
I
you
think he froze.
prevent it? Like
How do you
like
prevent diabetes?
no, not diabetes on your feet. I'm just specifically talking feet to where it's the keeping the circulation going. Is that a thing? Is that
Oh,
Is it a
ambulation.
necessary?
shoes? Is it a shoe? Yeah, like
Well,
Like what? Okay, specifically with diabetes and foot issues,
it's about peripheral
is
vascular
there ways
disease.
to prevent it? Is there a
Well,
way like
the walking thing is meant for, I think, mostly meant for what's called claudication. Did you have any cramping or anything in your feet or anything like
my
that?
legs?
Yeah, that's where the correlation came with the continuing ambulation. You
Ah,
want to get the muscles used to working with less oxygen. It could be the claudication. I'm no vascular guy, but it could be arteriosclerosis or basically plaques in the lower extremity. We do.
I didn't understand
Did
that
he
one.
squeeze the back of your calf? I'm sure he did.
Yes,
Right, to make sure there was no clots or anything like that.
yes.
So they rule that out, and then what they do is, like I have a buddy in Atlanta right now who's dealing with some lower extremity wound that would not close, and it didn't close until he started receiving ablation procedures by his vascular surgeon to open up his vascular flow. And yes,
Oh,
ambulation just gets the so if you do have some arteries that are just not working all that great, yes, vascular, but then increase walking to be able to increase the blood flow and get the muscles used to using whatever blood flow is available at the time for oxygenation of the muscles. But obviously, you follow up with your vascular surgeon in primary care for the medical aspect of it.
so as far as the feet go, I'm working with vascular also, and
Hmm.
they have done several procedures to
Hmm.
increase blood flow to my feet because
Hmm.
it's the furthest area away. So
Hmm.
right now I'm dealing with a injury on my toe, on my, I'm gonna say good leg, my only leg,
Now,
and what's that?
you dealing with that now?
Yeah, I'm back in a cast again. I've been
right.
in a
Okay,
cast for a long time now.
Okay,
okay.
Because
right.
every week I go in and he takes it off and he looks at it, and then yeah, so but I think in 2 weeks I'm gonna be out completely. It's healed up really nice.
Good.
But but that's the foot care part is I don't have that, I don't have that blood flow down there to help it get healthy
Right.
quick and
Hmm.
heal quick.
Hmm.
So being diabetic, and
Hmm.
my arteries are all fried and all that. So I have to work with vascular also to make sure, and I go there every 3 months for them to do the ultrasound for the
Hmm.
blood flow test.
Hmm.
They
Oh
put a
wow.
little cuff on your toe,
Hmm.
little, yeah, it's
Check the
good
blood.
stuff.
They're checking ABI, ankle brachial index. That sound
That's the
familiar?
word. That's the word. Yes,
Hmm.
that's the word.
Yeah.
Yeah,
So they're
I
ABIs.
checking.
was gonna say the same thing.
You were.
No, I wasn't.
But yeah, so honestly, the care is relatively simplistic for the patient, not for the doctor, but it's simplistic. You just have to keep eyes on, and like I said, a mirror to look under your feet is just very important. A lot of people, one of my shows, one of the better videos that Devlin could have found where I was talking about where people take their feet and they kind of put them on the shelf. Like when they find out you're a foot doctor, it's like, really? I guess an ingrown nail or two. And I'm like, dude, it's a little bit, just a little bit
No,
more.
it's
A little bit more than that. I mean, so people don't think the feet are important until they become a problem. Like I guarantee you, at some time, you never really thought about your feet. You're like, just whatever. I'm diabetic, so what? I mean, yes, somebody
never.
might
I
have
know.
sent you something.
I was a tale that, yeah, cautionary tale.
Yeah. So that's unfortunate, and that's how society is. Like certain things aren't important because it's not happening to you. So if something's happened to somebody else, it's okay, but it's all of a sudden a problem when it's happening to you. You know what I mean? No, so
Yeah.
anyways,
Yeah.
so look, so that's what the inspiration was for my book. Feet. What I did was Feet Naturally, and and if anybody wants to look that up, that's fine. It's called Feet Naturally Diabetes, and you have to put my name. Amazon's got my book kind of jacked up, so you have to kind of look for it. And also
How do you spell your name exactly?
Maasi.
That's where people make a mistake. They don't put that extra A, because that's what I did.
Yeah,
that's what I did.
I was gonna say the same thing.
Yeah, you
Maasi
gotta
Smith.
Yeah, you gotta put the whole thing in there. You gotta put like Maasi Smith or Dr. Maasi Smith, and then you have to put Feet Naturally Diabetes or Feet Naturally.
No, it's true.
They have my books as one book almost. It's weird. Like sometimes you find one, sometimes you find another. But if there's anything interesting in there, really, I hope people find some good interest. Not all about foot massages either. It's about natural products that can help heal. Remember, we had natural products in this. Oh, look at me. Oh.
There it is. There it is.
Oh, yeah. I don't look like that. I don't look. Yeah, I look better than I think. Now I'm just aging.
But I bought the book, and it is an easy read. It's very informative. My son has it right now, or I would have pulled it out. But he was reading it also, and he said, "Dad, this guy, he doesn't know what he's talking about." I'm like, "What do you?" I go, "What do you mean?" Hold on. I go, "What do you mean he doesn't know?" He says that if I have diabetes and I have foot problems, that I should limit my alcohol use. And he goes, "That's not going to happen. That's bad advice. That's bad advice." And I'm like, well, I mean, the advice is good. You're just not going to listen to the advice.
Hey, that's all. Now, you can develop, and a lot of people don't know this. Well, obviously, you can develop neuropathy from other things, including what's called alcoholic neuropathy.
Oh, great.
Yeah.
I didn't know that.
Yeah,
I didn't know that.
Overconsumption of alcohol over a long period of time. I've dealt with that in a clinical setting. You can also drug use neuropathy. That's something that will cause peripheral nerve damage, and there's some medications that your doctor will sometimes prescribe, and that could be a side effect as well, overuse. But they keep up with that more than I do. So, no, they would know.
Do you happen to know, like for foot health, is there a natural, because it's about naturally? I know you actually helped me out. You told me about something that I said, oh, the it's too expensive. The medicine, the cream was too expensive, and you told me about something that was purple, and then I went and got that, and then I found out that my foot doctor, has a thing of it on his
little purple thing.
Yeah. So what was that stuff? That's for people out there if they have
it's
injury. What is it for? Yeah.
Well, I'll tell you something. But here's the thing. I will do the disclaimer. Look, I'm saying what's been used in the history, but people out there do not. If you have specific instructions by your primary or medical professional, follow that.
I asked my doctor about it after you told me about it. Yes.
My belief is that we've got all these medicines over the past 20, 30, 40, 50 years, 60 years, whatever. Now all of a sudden the pharmaceutical companies like, ooh, let's make all this money. However, there was stuff that was around before all that helped heal. Now, one of the early things I believe is this product called Gentian Violet. I'm not sure exactly when it was developed, but it's this purple stuff. I have no idea how I fell into it. But Gentian Violet is $7. $7. Gentian, Gentian, 1% or 2%. It's an anesthetic. It's purple. It's messy as hell. However, that stuff will clean up a wound in a heartbeat. It's really, really good from my experience, people. Because we're in a litigious world. Somebody will sit there and be like, "What he told me?" No, I didn't tell you nothing. I told you to follow up with your doctor. I'm telling you what
my doctor agreed with you.
No, I believe it. I'm not talking about you. I'm talking about the world. This is open to anybody to hear. Next thing you know, I got legal papers like the next week. I'm like, what?
Go
ahead.
Any questions that's out there watching right now, put some questions on there if you guys have any questions for Doc, and I'll go on and ask the question. So you can.
Where's my dad? He's still on here. He better ask a question.
No, he's not here. Oh, and Tracy said like father, like son. By the way.
Oh, thank you very much. Yeah.
No, I'm not talking. It was Iceman, like father, like son.
Not listening. I think it's the not listening that she's don't listen to the doctor. But no, my doctor actually. I mean, I was so fortunate to get him at the emergency room when I had to go to the emergency room. It was him. I'm just so blessed. It's a smaller practice in Tacoma Hilltop area. It's Tacoma Foot and Ankle Clinic. The staff there, Christine, is just phenomenal. There, his name is Dr. Hwin. My wife could. Yeah, my wife could tell me his. Yeah, he's a podiatrist.
I went to school. I went to school. Yeah.
Oh yeah. You went to school with him. That's correct.
Yeah, I recognize the name, but I think he was behind me or something like that. Or you mentioned it before.
What's the practice name? What's the office name?
It's Tacoma Foot and Ankle Clinic.
Nice.
That's exactly what it's called. And the only reason I went to them the very first time was they're the only ones that took walk-ins. I was hurting, and I was like, we got to drive down the hilltop, which is an area down in Tacoma. But anyway, it was kind of it was far away, but we had to go there. And then I was just it's a blessing to deal with him. He's all about like just making sure, taking his time, and I've been fortunate to be with him for all these years. Anyway, I just want to put a shout out.
No, the thing about podiatrists is because we're so focused on what we do, we take a lot of pride in exactly what we do. You know what I mean?
I can see that.
Yeah, because we don't have to do like the primary care physician. Yes, we know some things, however, because obviously you have to learn when you're in school, general anatomy, physiology, pharmacology, and all that type of stuff in microbiology. But once you get into your practice, you're actually just really focused down on that. So that's why when people come in, you kind of look and you kind of like, all right, I see what's going on. And I say, well, how'd you know that? Because somebody else said they have pain in a certain place. And I'm like, yeah, well, you have spurs on the aspect of your foot. When you get up in the morning, it hurts like crazy, right? Like, yeah. When you walk a little bit, it kind of clears up. Yeah. Plantar fasciitis. Like, dude, I was in here for like 1 minute. And then I'm like, give me my copay.
Did to me.
Give me my copay.
And he goes, just go get a brace. And
just go get a brace.
Well, which brace? Just go get a brace.
Just go get a brace.
I know.
So that's the best thing about us. Yeah. And so
I know a big one is that plantar fasciitis. That's what I thought I had. I self-diagnosed myself with that first, which was incorrect. Yeah. But apparently that is a big thing. I know a lot of people that have it. You want to explain that a little bit?
Plantar fasciitis, just very common. Nobody really knows where it comes from. It could be increased weight loss, increased activity, and actually I have a spa that that's.
Can you go back? Can you
what's
go
that?
back to that? I'm sorry. You said fast weight loss.
Well, anything that stresses the feet. So your feet are working with a certain weight every time it takes a step. Angle your gait analysis, right? So if you gain weight, that causes stress in your feet. If you lose weight, that's a different type of stress in your feet. So any activity can cause, or
I didn't think of it that
athletic
way.
activity can cause pain. And your arch, the plantar fascia is here. So this is your foot, right?
Right.
And it stretches the back, and this is where the spur comes from. Now, I will dispel one thing is that.
Never thought of that.
Yeah, the spurs, it's usually 99% of the time is not what's causing your pain. Everybody think it's spurs. We say spurs because it's easier for you to grasp what we're talking about. But it's usually the plantar fascia that's pulling. Wolf's Law, bone will react based on the forces placed upon it. Dang, I sound smart, don't I?
It's almost like he's a doctor.
I know, right? Where you guys know me in the metaverse, and I don't be doctoring up in there acting crazy.
Mandy has a question. Mandy has a question for you.
Okay.
Question for Doc. Any recommendations for pedicures or foot massages?
Really, Mandy?
Well, Doc does a lot of good ones. We saw it on the video.
Really, Mandy? That's all you got, Mandy? I'm sitting here talking fancy words, and you come up with, is there anything to
read it?
What'd she say?
And I go, all right, here we go.
You got a question? Yeah.
Epsom salt.
That's true. I've been told Epsom salt. For a long time.
Look, that's all you had to do.
See, good question, Mandy. Good question.
Yes, excellent question. All right, so aren't we doing something like November, December?
Right. So, I wrote that. I got it right here. Right? So, listen, everybody. And hold up. Before I do this, I want to get a shout out because I know you gave a shout out to your doctor, but I want to give a shout out to Vaughn Podiatry, Alabama. I think he's in Montgomery. Vaughn Podiatry, Foot and Ankle Associates of North Carolina was my buddy Clarence and that crew, and Dr. Fitzhugh and Jason Miller up in somewhere in Pennsylvania. Premier Orthopedics. Brian Pontarelli, who's out in Rhode Island, who also has a spa. So if you're trying to get some things in Hatch, he'll help you with that. So Brian Pontarelli, Jason Miller, Dr. Hadrian Vaughn, it's Vaughn Podiatry in Alabama, and Dr. Clarence Stewart in North Carolina. I'd like to give those guys a shout out. So if we become really, really big, people see this old episode and they'll get business.
Right.
So the hell was your question?
No, Heart Initiative. We
There we go.
Raising awareness.
so look,
stay on track. Stay on
track. So
stay on target.
Listen, guys, like we said, we're trying to give back as well as we get. Yes, we're three old guys doing a podcast. A lot of our stuff is based on opinions. We don't try to get into any real controversial stuff. We're trying to make things better as best we possibly can, and the power that we have, which is limited. However, we can increase that power by doing some important things when it comes to the world and how we can put our little 2 cents in and help out. What we notice is a lot of people are having difficulties out there. Not because this is not political climate. It's just the world in general. You have people starving all over the world. You have people that just can't get the basic necessities that they need. And we know we can't affect it all, but we can affect something, right? So we developed the Heart Foundation, and it's not official yet. This is something we're working on, helping every American reconnect together. And keep in mind, even though it says American, oh yeah, right, heart.
Yeah,
that's
heart.
it, right? I said, oh yeah, heart.
No, you said it right. I'm just telling everybody that's what it. Yeah, that's the.
Okay, heart. So a great acronym, right? So and keep in mind, people, we come up with this stuff together, and I love working with these guys. And that's all credit I give you. So
this is Doc. This is Doc. Yeah.
So what we're doing is we're trying to establish relationship with entities in our particular areas where we can offer some sustenance in terms of like Thanksgiving and Christmas, whether it's food, toys, and whatever we could do this holiday season. As you've seen, we've given you plenty of time. It's May. So we're going to be having initiatives, clothing drives. We're going to team up with certain organizations. Iceman, you have an organization that we're teaming up with?
Yeah, you want me to tell you about it?
Oh, absolutely.
Okay, so in my local area, it's called the Eatonville Family Agency.
Mm-hmm.
It's ran by Kylie Hutchings, and she's a director of it. And then also I work with Emmy Lay. She's also a contact person. And they do everything. They're just doing something now about a trash drive, which they got a big dumpster, and for all the local people for like $20 donation, they can dump their trash. And so all that's going to the family agencies, but that's just one thing. So I contacted them, and they would love for us to work with them a little bit on that. And so that's my charity of choice. That's what I'm going to do. But they feed people. They do, Christmas families that need help that they can't, Christmas presents, everybody. This is community's great. Edenville community is just very helping, giving, and they also help outside area also. So that's Edenville Family Agency. I will be promoting that more and making some videos and stuff about that when I talk to them and make sure everything's good. But yeah, Edenville, that's who I'm going with. They're just outstanding.
And I'm going to be working with some children's homes. So I'll
go ahead
and get you more into explaining that later when I get more information.
You know what you're doing, but that's what you're focusing on is children's.
Some,
children minister. Yeah, awesome.
Well,
awesome.
You're a children's minister, yeah. So or
it's going to be
previous.
And stuff,
yeah. So one of the organizations I'm going to work with, it's Covenant House. And Dr. Stooks over there is doing a fantastic job or a community awareness as far as really, it's an inner city clinic in which I'm at, and they're doing a phenomenal job. There's some great people out there. Danielle, Dr. Stooks. Well, no, I'm not gonna start naming people because if I start naming people, then what happens? I'm gonna miss somebody. Tiffany Alvin. But anyway, no, but they really have. I'm gonna make them all help me. Now. I haven't officially teamed up with them, but what I did do is their presentation in reference to VR and how that helps and
Mhm.
clinical evaluations and education and
And
community
we do have
engagement. So
a
I did do that.
just for
Hmm.
context, we do have a Covenant House inside VR already set up for them. So
We do.
if
I
you
need to
guys
do
are
one for
listening,
Edenville Family
you guys
Agency.
Yeah, we can do
I
that
need a
too.
place in
come in.
VR healthcare for that.
Yeah,
Yeah, how much you got?
What-
yeah.
we'll work something out.
So, yeah, no. So no, we're always open to bringing more
Yeah.
organizations. But we did, and thank you, Devlin. Actually, both of you, because you guys do the technical stuff. Thank you for setting that up for Covenant House and
Oh
stuff like
yeah.
that.
Yep. That was a
And
lot of fun. That was a lot of
and
fun.
our Devault with Devault Law.
Devault
She yeah
Law
Devault Law. We got to
LLC.
give her some love up in
Devault
Woodbury.
Law LLC. Yep.
She's
Oh
doing some
yeah. Yep.
fantastic
Yep.
work,
Yes.
I'm
and
Go to her.
learning
very
stuff.
Go to
supportive.
her.
I'm learning stuff with
Go to
working
her
with her.
website.
Yeah,
Yes.
yeah,
So
she's good lawyer.
oh,
Yeah, good,
okay. I do have a
excellent lawyer.
story. I do have a story.
Oh, go for it.
That I'm just gonna bring it real quick, and this
Hmm.
has to do with Devault Law and actually UDOC. So I'm getting ready to head up to Seattle next week,
Woohoo!
and woo woo. So I'm going up there, and I'm like, all right, I gotta get my ticket and blah blah blah. So I bought my ticket, and then Doc decides to send a message in the messenger. Hey, don't forget about your real ID. Oh, okay. I don't have one.
I gotta get mine.
Oh man. So then Mandy sends me a message.
Hmm.
Hey, Devlin, can we make a blog about a real ID?
Oh, after the fact.
I was like, that will. Well, she sent it. She sent it to me, I guess,
Yeah,
first
yeah.
before Devlin got involved, and I
Mhm.
said we're working on this blog, and then I was like, didn't you read the stuff that I'm putting together for Amanda?
Mhm.
Like,
Mhm.
Oh, it
I was
was
like, it's
good.
all about the real ID.
Right, I know. And I'm like, yeah. So needless to say, I'm still going up there next week. We're all
Mhm.
set. I'm ready to come up there. So yes, thank you.
Yeah,
Mandy,
thanks, Amanda.
for getting us all set up
Where's the
with my
claps?
real
Give her claps.
ID.
Give her claps.
Oh yeah.
And
Yeah, wait,
All
wait,
right,
wait,
Amanda.
we're gonna take that control from you because you don't know how to use it. I don't hear claps. We're claps.
No, I didn't. That's because I didn't hit the
The
other.
claps are gonna be like next week. We're
Yeah,
gonna
it's
get
like
them.
2 weeks later, bro. We're gonna fire
But
you.
anyway, thank you, Amanda.
No,
Yeah, we're
thank you,
learning a
Amanda.
lot
So
by working with you.
one of the things with medicine, I know we talked about foot care. Oh, now with our heart foundation. Now,
Thank you.
listen to our motto, our family out there in the metaverse, multiverse, real life. Listen to the
Yes.
motto that us three have come up with. Listen,
Come on
because
now.
things are hectic. In the chaos we give, in the giving we heal. That's the motto for our heart
There we go.
foundation.
One more time.
No, I want to clap next time, dude. You be
No,
messing
no,
up.
yeah. Say it one more time. We'll get
Okay.
a clap ready.
So our foundation heart, helping every American reconnect together, and that means everybody, not just American. Okay. And the chaos we give, and the giving we heal. Bro, that's just nasty right there.
That was you
That's
guys.
just
I
nasty.
had nothing to do with
That's
that.
just nasty.
That sounds
So,
great. That was
dude,
the first
I
time
try to get a
I
man
heard
credit,
that.
and he just kills it right on
I know.
the
See,
show.
No,
So-
no, I just that's you guys. I was impressed with that.
So-
Really, that was the hearing that was actually good. I'm glad.
Yeah,
I'm glad I
we
heard it
are-
naturally like that.
We're excited.
So,
But one of the things I wanted to end toward the end of the show, and I know we're getting there, is that people need to understand with virtual reality and the metaverse, right?
Mhm.
Virtual reality is just not gaming, folks. Get it out of your head. Just like you use a computer for business and you can use a computer for gaming, the same with virtual reality. You can use it for gaming, but you can also use it for business and some real educational opportunities, please. So you'll be surprised how major universities are using VR to further explain. And that's the presentation I did at the Covenant House. Major universities are using this to educate their students, educate their patients. Show like you have a boot, right? So, Iceman. So you have a boot. So sometimes there's some training. If you have a crutch, there's training. So not only can the doctor do it, but that can be reinforced in a nice immersive 3D environment. And it's hard for you to get people to understand how immersive it is. So there's one video I want to share. What you got?
Oh,
What you got?
yeah, real quick, I'm going
Go
to add
for
on
it.
to what you're saying right now.
Mhm.
They're all going to understand this in about 6 to 7 months when Google releases their headset because
Right.
it's going to be for production or
Mhm.
it's for productivity. So that's what it's going to be originally for. So once that comes out and everyone is seeing what that's like, it's going to change everything. So
the
so
Google one looks
just so you
amazing.
guys know, we're in here waiting for you. So we've got
That's
it
what I was
all
gonna say.
set up
That's what I was
for
gonna
you.
say. Yeah.
We've got it all laid out.
Yeah.
So when you guys decide to catch up with the rest of us, we'll see you when you get in there.
If you're a doctor, allied health, whatever, and you want to have a place in the metaverse, and it's not like you're gonna get all this business immediately. It's like there had to be a first website, a second website, a third website. That's who we're at now, where we're at now in VR. And all you people that I sent information to, and you're kind of like, yeah, keep saying
Yeah,
then you'll be calling me, then I'm
don't
gonna
worry.
charge your butt.
Yep.
I'm gonna charge the heck out of you.
my
The
sister's
feed was 25 feet. Now we're going to a 26 feet. Okay.
Mhm.
So
What you gonna say, man?
20,
no,
26 feet.
so my sister is involved, like she's in the multiverse, cardiac rehab. Some people
Oh,
know her in
right,
there.
that's right.
Yeah. So she's busy with 2 kids and all that stuff, but she's trying to also get involved in the healthcare and bring on like some cardiac information
Right.
into it, as
got-
far as storefronts and stuff.
Yeah, it's got to start from somewhere, right? So yeah, it's not the busiest platform in the world, and it still has growth and a lot of things it has to do. But you have to realize if when there's one, there's two. When there's two, there's four. Like the bacteria we were talking about, it's just going to be steady growth. I mean, in a nicer way though. So here, so
What's the video?
I'm here. So I'm going to share. Give me 1 second. Let me make sure you guys got it. Okay, screen. Hold up. And we're going to start with this one real quick. My friends will appreciate this. Oh, look at that. Hold on. Look at that.
Are we gonna get ready with the claps? I don't know.
Hold on. There we
What?
go. This right here. Oh, look at that.
Going deep for it all. Devontae Smith.
You guys see that?
He has got it. Touchdown.
Yeah, I'm sorry. I think it's going to be 34-0 at this particular time in the third quarter. So I apologize. I didn't mean to show people that or tease them. Can you guys see it?
I see it.
You don't see
Forget
anything?
on the clock. That's the dagger.
Oh, okay. So
Unbelievable. The
okay. So I just
play
want to make sure that was
action
seen. I will
So-
change that. Hold on.
So what? So what are we looking
Just
at there?
dropped an
Well, we're looking at the
absolute
Eagles,
dime
Why?
to Devontae Smith.
Because that's what I
Everyone
wanted to do.
thinks
All right, hold
Saquon's
on. Here
getting
we
the
go.
ball. Hurts
Now, can you guys
again.
see that?
Has all the
Yes,
time
we
in
see
the
it.
world.
You can
That's
see.
not
And he
you.
makes
That's
the
not
throw
you.
of his
No,
life
that's not me. But do you
on
see? You see
Jalen
the
Watson.
The
the
Smith.
Smith beats him.
the skill, right? No. So basically, I'm showing this to show how augmented reality is. That what you guys see? The skull right there.
Maybe what could be the dagger
Yeah. Wait a minute.
today
Well,
for this Eagles offense
You
and
don't
this
see it?
Chiefs defense.
that's
Wow.
augmented reality.
Everyone in the
Oh,
world thought they were going to
Okay,
run
so
there,
what
and
they're
then
doing,
Hurts
they're using
unleashed that
augmented
46-yarder, and
reality to
Devontae
basically
Smith
visualize
had a
the person's
100 yards
face
in their
and
Super Bowl
understanding that,
matchup
wow,
a couple
only
years
21 minutes.
ago.
But anyway,
Hauls
to
that one in.
understand,
He's got
I wanted people to
69
see
yards
how
and a touchdown
technical
today.
virtual reality
And
and
Steve
augmented reality is
Spagnuolo,
becoming. Augmented reality
not
is
sure what to
virtual
call
reality
right
that's kind of
now.
an overlay on the real world, if that makes any
got
sense.
it. No, I
I
got
tell
it
you, I
now.
certainly
We
wasn't
see it so
expecting a shot
naturally
play at that
Right.
point.
that we don't even
maybe they
recognize
try to run
it.
4 minutes
How
off the
hectic
clock,
they,
get it to the
how
fourth
not
quarter.
hectic, but
They had
let's
their
see.
own
Can you hear
ideas
this?
about
Is
what
this
they
up?
wanted to
Yeah,
do.
we can take it off.
And so much of this comes down
You
to
can see it
great
now? You can see it. Hold on.
execution. When you have these
Okay.
plays, you know how meaningful
And you
they
can
are.
see this
You're
VR
coming
healthcare
down,
for healthcare
you put 5
healthcare
months of
uses
football
cases for
on the
VR.
line. You played a tremendous season.
Do you really?
And there
Okay.
they are.
Oh, you
My
still
name
see the
is Dylan
football?
Shaw,
No,
and
no,
I'm
that's
using
not where I wanna-
Upwork to hire an LLM developer.
Here,
Upwork provided
there
a
you go.
ton of options
I got
for
you.
exactly
Is that better?
depression, phobias, and other mental health issues
Now we got another commercial.
to manage
You're still seeing.
pain.
Wait, let me kill this.
While VR may not actually impact the physical sensations in the body, pain-specific VR applications teach patients how to
Okay.
cope with pain
So
through
I'm
breathing
sharing
techniques
this
and positive thinking.
for people to be able to see the case
To adjust
uses.
bodily
You're looking at
awareness.
this as bottom right,
Particularly with
tech
patients
target. Is that what
experiencing
you're looking
chronic
at?
pain or struggling with weight management, VR can dampen the effect that body signals,
Why'd I
like
even
pain
try
or
this?
hunger, have
Wow. No, I didn't even know that.
Yeah.
Okay.
to treat cognitive disorders. Virtual reality can help patients with dementia
So it has
or other
the,
cognitive impairments better cope with memory loss, judgments,
So you don't
and
have to
distinguish
hear it.
hallucinations
Yeah.
from reality. Of course,
So I just wanted to
VR
give
will
people
not
an
replace
idea.
face-to-face
Obviously, there are many
interactions
other
and treatments for
cases
healthcare
and
professionals
reference,
completely,
and
but
reference
rather
virtual
serve as another
reality and
tool
how
for
it
effective
can,
treatment.
help people in their daily lives in medical care and where it's going. So that's
That's nice.
yeah. So that's pretty much that. Yeah. So
So we're gonna wrap up. You gonna stop? Sharing
I don't know. How do I stop sharing?
Up on the top. Hit.
Oh, there it
stop
is. Why you tell me that before? You tell me that before.
Yeah, come on, technical guy. You're supposed to tell us this stuff.
Mm-hmm. I don't know
sharing.
how
Why
to
is
do
it
that.
still not gone? Why are you doing? What are you doing, Doc?
Is it? Did I stop sharing it?
No, you didn't.
You just
It's
closed the
okay.
window.
You just closed
Well,
the
that's what
window.
I thought. All I had to
No,
do.
You want to stop?
Three. What does
Down
the
at
doc
bottom,
say? Three
down
old
at the
guys
bottom,
trying to
yeah,
do
three
this
old guys.
podcasting thing.
Down at the bottom, you want to hit the share. Down all the way at the bottom, you see share, and then
Yeah.
close that. Just stop
Oh.
sharing.
Hey, I'm making fun of it, but I can't do all that stuff.
Yeah, I don't know what you're talking about. Stop sharing. I see stop sharing right now. I don't
On
see
top,
stop.
Click all the way on the top. You should see stop sharing, top left.
Nope.
Don't worry about it. We'll leave a blank screen right there. Don't worry about it. We're gonna
No, throw up our end with our logo or something.
Well, hold on.
Don't end with a black screen.
Let me see. Hold on.
Throw up the media for you, and we'll say goodbye, and then we'll play the media for you, and we're done.
Because he's casting, so we
All
can't
right.
wait until he's casting. So
Oh.
Let me close in prayer. Dear Heavenly Father, we thank you, God. I thank you for this podcast. I thank you for sharing all of this information today, God. Lord, I ask that you continue to help this podcast grow, help people to love one another and care for each other. We just love you so much. In Jesus' name, amen.
Amen.
And
All right. Oh, yes.
the last part, I want to thank Pac-Man Jones for taking my call. Anybody know him? He's an ex-NFL player who was very gracious of trying to get us on the show, get him on the show. And we also we're following his show as well. He has a podcast.
Yeah, he's a real. I didn't know who. I heard the name before, but he's like a real celebrity. Like he's a real.
Yeah.
No, really. I didn't really know him until I started looking into him. So I appreciate that with Doc. I was like, dude, the guy is like, he's known.
Yeah, he's excellent.
You know?
Yeah.
Yep.
So
Yeah.
I really appreciate him taking my call back. I talked to him, gave him the pitch for about a minute, and it was really nice.
Nice.
Awesome. All right.
All right.
Thank you guys. Happy Mother's
See
Day.
you guys later. Happy Mother's Day. Love you all.
I appreciate it. And I messed up the screen. I'm not doing this that text.